Apply clean gloves. And determine which system is in use, how many drainage tubes are in place, and what kind of drainage is expected from each wound. Place a waterproof pad and a graduated cylinder or specimen container on the bed between you and the patient. To empty a Hemovac or Constavac drain, open the plug on the port through which the drainage reservoir empties. Follow aseptic technique. Tilt the suction container toward the plug, and then tilt the evacuator toward the measuring container. Allow the contents to drain completely. Unwrap an alcohol swab and hold it in your dominant hand. The suction device should be on a flat surface with the open outlet face up. Cleanse the opening and plug with the alcohol pad. When you're finished, press down until the bottom and top surfaces of the suction device come into contact and immediately replace the plug. Make sure a vacuum has been reestablished and confirm that the tubing is patent. Check to make sure the tubing is not pulled tight and there is room for the patient to move without creating tension on the tube or dressing. Leave the wound device on the patient's bed.
Mr. Fulton, I'm going to empty your Jackson Pratt. Okay? Okay, let me take a look at your drain.
To empty a Jackson Pratt drain, open the port at the top of the bulb-shaped reservoir. Tilt the bulb toward the port and drain the contents. Collect the drainage in a measuring container. Use an alcohol swab to cleanse the end of the emptying port and the plug. Then, compressing the bulb over the drainage container, replace the plug to close the port. For any of these devices, place the drainage system below the wound site and secure it to the patient's gown with a safety pin. Check to make sure the tubing is not pulled tight and there is room for the patient to move without creating tension on the tube or dressing. Proceed with changing the dressing if indicated. Note the characteristics and volume of the drainage before you discard it.
I'll come check on you in a little bit.
Alrighty.
Dispose of your used supplies. Then remove your gloves and perform hand hygiene. As part of your follow-up care, periodically observe the drainage in the device and watch for leakage. Assess the patient's pain using a scale from 0 to 10.
Everything looks good.
Record the volume of any drainage on the intake and output form in the patient's medical record.